Data governance is a major issue in healthcare. In addition, data overload has become a barrier for gaining just basic insight into problems that really need to be solved. A friend of mine last year shared with her healthcare provider that the food was not good during her hospital stay. This friend, she's very involved with her healthcare system, and she had wondered if there's other patients that had similar experiences with their food. And so she simply asked one of the administrators if she could get some information from their HCAP surveys to see if other patients commented about the food, should be the qualitative data, or if the scores maybe had gone down in the quantitative data. The next meeting, the administrator brought in someone to do a presentation, and they delved very deeply into the food service, providing average heating temperatures and so much information that did everything but answer the simple question raised initially. Did other patients also report their food quality was cold? Yes or no? Nowhere in this lengthy report did it contain this basic information, no comment analysis. Instead, it turned into an hour presentation on that which was totally irrelevant to the issue. Interestingly, another meeting that I had been in last year, an individual began presenting some very complex data. And everyone in the room, you could tell, was very puzzled. And I finally asked the person, can you share what was the problem that was trying to be solved when they first asked you to put this report together? And he could not recall. And that kind of sometimes is what's happening, where we get so paralyzed by data that we forget the actual problem we're trying to solve. And it must be simple, basic, clear, concise, and able to help us gain insight into what is really happening so we can solve the problem. Sometimes we're not happy with the results, so we want the report to come out differently, and we start putting in more requests for different kinds of reports to show different outcomes because we maybe are not willing to accept the results of that data that already came back. So let's keep it simple. That's the reality with data. Keep it simple, look for trends, and use that data to improve things.